We scanned every parcel of land available in the city of Lincoln, and we finally found this place.
The founding physicians saw something in this field few could have imagined.
There were cornfields, and there was nothing here.
In the middle of rows and rows of corn, they saw the future of healthcare.
If we want to bring cutting-edge technology to small town Lincoln, Nebraska, we need to work together. We need to bring specialties together that can work collaboratively.
It all began in 1987 with a group of doctors who formed a unique partnership, the Nebraska Heart Institute. One team doing one thing well.
What that did, that we were able to recruit heart failure specialists, we were able to recruit interventional cardiologists, electrophysiologists, lipid specialists, and among surgeons, somebody began to focus on valve surgery, other began to focus on transplant, and third began to do how to do better bypass operation.
Super specialized physicians who grew into the next century by being better than good. The passion they brought to the Nebraska Heart Institute translated into a lot of firsts. The first off-pump bypass surgery, the first minimally invasive surgery for atrial fibrillation, the first transaortic valve replacement, the first heart transplant in Lincoln, and the list of cutting-edge procedures goes on. They are the first that carry a lot of responsibility, first that start and end with a skilled team.
Over the years, Nebraska Heart has collected a core group of people that have been passionate about providing the most up-to-date, quick, emerging technologies for patient care. There's a passion that is unsurpassed, and that has been present for over the last 25 years. It's that kind of passion and interest and willingness to seek out new therapies for patients that has set this place apart.
It was that passion and the desire to deliver quality care in a different way that helped the Nebraska Heart Institute grow. NHI serves Nebraska, Iowa, and Kansas with more than 40 community-based clinics and 6 offices in North Platte, Grand Island, Hastings, Columbus, Kearney, and Lincoln.
I never did think when I was in medical school that I would be going out to little communities, but it has been very, very fun, gratifying.
And I think the people are very grateful. I mean, they got to know me, I got to know them. They referred family members, and it was really a great experience, man. They really appreciate what you were doing.
And that's what makes the Nebraska Heart Institute what it is today.
It just adds a dimension to their care that is really priceless.
A model practice leading the way in complex cardiac care to those in need.
We've had a long, trusted name in the field of cardiology, bringing very good quality care to the patients, and we've just become a very trusted organization.
A trusted organization striving to give patients the very best. In 2003, they took the next step. The Nebraska Heart Institute opened Nebraska's first heart-only hospital.
If you want to grow to the next century, we need to be in control of our own destiny. We decided this place would be run by surgeons and anesthesiologists. They are all super specialized physicians who deal nothing but cardiovascular and thoracic care.
A 63-bed, state-of-the-art facility.
Every room is ICU compatible. The patients come in one room and get dismissed from the same room.
Focused on healing all things heart.
So right from the beginning, we had maintained extremely good quality of patient outcome with one of the lowest length of hospital stay. We have been #1 in the state for several years in a row, 5 or 6 years. And now we are in the top 2% in the country for overall cardiac services and cardiac surgery, and top 5% in vascular surgery.
With scores like that, it's easy to see how the Nebraska Heart Institute and Hospital has become a thriving center of excellence, where they not only see patients come first, they do.
We have been always very compulsive about quality, so no matter what is done to make sure the quality is maintained. That is from day one. Quality has always been our concern.
We're very proud of our numbers. A lot of people say they're #1, and in this region we are.
The numbers are only part of the equation. Employees, all 500 of them, give something special to the job, a dedication that leaves patients feeling like family.
It's just the satisfaction of seeing a person that comes in here is sick and they feel as bad as they do, to be able to go home in 4 or 5 days and their outcome is better than they expected. And that happens almost routinely around here. To be able to see that, it's pretty cool to be able to be a part of that.
We see people coming in scheduled, we see people coming in from a helicopter, from an ambulance, and regardless of whether they come in smiling or not, they leave smiling, they leave healthy. We get to make a difference and we get to change people's lives. I mean, that in general, just the memory of doing that, I love to be on call. I love to come in the middle of the night and help take care of someone and make sure that they have a good tomorrow.
And that's the way they come to work every day, from the cath lab to the exam room. They want to make the patient's experience a memorable one. At NHI, it's part of their culture.
I like knowing that I can look at their family and look at that patient and say, you know what, we're going to take care of you. We're going to get you home. We're going to make it better.
It's an exceptional organization, and I think we give exceptional care. We're compassionate and very caring, and we really care about the patient.
Now they're changing with the help of Catholic Health Initiatives. NHI partnered with CHI in 2011 to continue the mission of delivering quality heart care to patients throughout the region.
And that's a new chapter in our journey. It's very exciting because we're able to continue the legacy that we have with the wonderful system and the resources and stability that a system would allow for us. And so our patients and our staff are going to benefit from this relationship.
One of the things that we always knew about Nebraska Heart was their commitment to quality. But beyond that, this whole notion of caring for the whole person, body, mind, spirit, is who we are about within Catholic Health Initiatives. So to have that sense of feeling or that spirit, that spirituality flow through these walls is really a perfect match because we all share in healing people.
Now with the help of CHI, the Nebraska Heart Institute is moving forward, able to expand its mission to a whole new level. The dream, 25 years in the making, is just getting started.
Nebraska Heart Institute, Nebraska Heart Hospital are real gems in the healthcare delivery system for all of Nebraska. It's a gift to our Nebraskans. Nebraska has outstanding care, and Nebraska Heart is one of those reasons why.